heard the news about ADAT, Dr. Ahmed?
Which news? The
specialty one.
Oh, yes. So now they're the specialty program for foreign trained dentists, the one where they could use ADAT to get in.
Yes.
Yes. Isn't that like so many things are changing so fast in the last years?
Yeah, interesting, right?
It's just like there's the most changes I've seen in this whole NDEB process, like in this time frame. There's so many different things.
But very interesting.
So what is it? You want to explain exactly?
So I read University of Toronto would be accepting ADAT for the specialty programs from 2025. So
they're training the University of Toronto when is accepting specialist foreign trained dentists.
Yes.
Now they're accepting ADAT into that program.
Yes.
Into their is it still called the DSTAP?
DSATP. That program was there, but now no, it is still called DSATP. That's the program. It's a 1-year program. But for the initial admission, like into that, plus the interview, they want to take the ADAT as the base exam. Yes.
And it's only UFT for now.
For now, I read about you.
ADAT is becoming more valuable, really, to students, right? To the foreign trained dentists. Well, let's take a little trip back in time and just kind of discuss how it was, so people kind of get a. So first it was DSCKE. I have a video about this on YouTube, actually. I don't know if you saw it. But
I saw it. Yes.
Yeah, first is DSCKE. They do that exam, and then they go. They use that to enter the specialty program.
Yes.
So did you ever end up doing that?
I read about it. I saw your videos. Yeah. So when I first came here, I was planning to apply for that. So I was looking for radiology programs. But
you're a specialist?
Oral medicine and radiology.
Oral medicine and radiology. And then you tried to apply to the radiology program.
Yes, but there was no seat during that time. So, and plus you cannot practice the general dentistry if you're a specialist, right?
Yeah. So that's the thing. Like, let's say you're a foreign trained dentist coming from another country, you're in Canada, but you're a specialist.
Yeah.
There is a pathway where you could get licensed as a specialist.
Yes.
But you could only practice a specialty.
You can only practice the specialty.
And in your case, you're a specialist in oral medicine and radiology. But in Canada,
they're two separate.
They're two separate specialties. Yes. So how does that work? Do you get a free ticket for both? Or
No, we have to really I think I didn't go that part. So I didn't go into depth of that. But if I would have been going through that, so I would be probably talking to people in the university, how exactly that works. Yeah. Because there are loads of requirements apply for the examination.
But the DSCKE. So in order for you to get into that program in university, it was it's a 1-year thing.
Yeah.
But during that year, you said there's no seats.
During that time, it was no. Even for 2024, there were no radiology seats.
That's why it's a risk. So back then, when I used to do what I used to recommend in that case was don't do the DSCK. Don't start with that because it's an it is expensive. Well, it was 7,000,
8,000, yes,
just for the DSCK exam.
Yes.
Yeah, it has a whole separate application to the NDEB.
Absolutely.
And I would tell people, look, either wait until you're done ACJ, then do it if you have resources, or just finish the whole direct pathway.
And then think about it.
Where you have more, maybe income. It's less of a risk.
Yeah. I have a few friends who did their AFK plus ACJ. So they had all the knowledge.
Yes.
And then they went for the exam. They cleared it.
Yeah.
Now they are practicing as specialists in Canada.
Oh.
So I have a few friends. I know a few people.
What specialties do they just out of?
Ortho.
Ortho is a common one, I think.
I know someone who is in perio also, but they went through that MSc path. They did MSc perio, but that is a separate path altogether.
Yeah. So they can only practice a specialty. They can't practice the general dentistry.
Yeah.
Now, so they applied separately. Were they doing the direct pathway as well? Or the general dentistry pathway, or do you not know?
I don't know.
You don't know. Yeah,
I don't know.
That's interesting. So back then it was that way. And some people made it, people made it. I know one person that actually
I've heard stories. I have heard stories. I have heard stories. People did their MSCs, people did their this pathway to get into the specialty. And I have heard people are doing PhD also, internationally trained dentists who come here and do their PhDs. So
and does that give you the ability to practice, or is it an academic license?
A PhD is more of an academic license.
So you could only practice under the university, or
I think so.
Yeah, that gets a little bit more tricky, that area. For me, it's a little bit more a vague pathway and less predictable. So, so this is just to make sure listeners know what we're talking about. This is the older way, like you know, with the DSCKE, then you could get into the universities, right? Into specialties.
Yes.
But there was a gap. There was a phase where the DSCKE just became, just got like, they were canceling it.
Yes, 2023, yes.
Do you remember?
Yes,
it's
yes.
Okay, because we hoping for it.
Yes,
yeah. They can't, because the NDEB doesn't want to do the whole dental specialty exams.
Exactly.
They transfer it to
RCDC.
RCDC.
Yeah, so now the NDSE, the last exam of the specialty, like even if you are in this program, like the DSATP, like you cover this program in the university, that's a 1-year program, or like you are training for the specialty in Canada, you have to give one exam, that is NDSE. So that is now conducted by RCDC, Royal College of...
Yeah, so Royal College of Dentists in Canada. Yeah. Yes, so the NDEB is like and the NDSE is the exam all like even domestic or local dentists have to do, like someone that's trained here as a specialist. Specialist.
Yes.
So if you're doing endo here, you have to do the NDSE.
Yes.
NDEB no longer wants to do the exams for the specialist.
Yes.
So they transferred the NDSE, which is the final board specialist exam, to the RCDC. People are listening for the hearing about this for the first time.
Royal College of Dentists of Canada.
Yeah, they're all confused. There's so many.
There's so many bodies. Multiple things happening here. We are used to it now.
Yeah, we are used
to it now.
So if you're all overwhelmed by all these terms, it's okay. You know, we're very used to it, so it's okay for others to be confused. But we're clarifying it. So the RCDC is going to do the NDSE, but in that time frame, the DSCKE was not available anymore.
Yes.
So there was no pathway for specialists, foreign trained dental specialists.
Yeah.
There was no pathway for them, basically.
It's very vague. So like it was not like nobody had a clarity on how things are going.
Yeah.
But now, very specifically, University of Toronto, when you go to the website, so they say for 2025, they would be taking ADAT. So it's absolutely clear now. Like you have to give ADAT for like as a first step towards your specialty.
Yeah. So technically you could say if someone already knows, ADAT is replacing DSCKE.
Yes.
Pretty much. And then you could take ADAT.
And ADAT has absolutely replaced AFK. Oh. University pathway.
ADAT is growing. It's like taking over.
Yes, taking over. Yes.
So now this makes ADAT even more valuable.
Yes.
So people that are doing the ADAT exam could apply to both. Just use that one.
Absolutely.
Were you thinking of possibly open, or are you too far in the direct pathway that, you know, probably don't want to?
I'm almost done.
Yes.
I'm almost done. So...
Yeah, no, it's but yeah, do you ever think ADAT will take over AFK in terms of direct? Was that even a thing that could happen?
We don't know what happens. Probably yes, probably not. But because we have two pathways right now, like we have the direct licensing route and then we have the university pathway. In university pathway, majorly it has taken over. Like almost all the universities are now accepting ADAT.
Yeah. So you mean, the university pathway, they're all switching mainly to ADAT almost.
Yes.
But yeah, like I don't think the NDEB will ever switch because it's such a Canadian, like the NDEB is Canadian specific, I think.
Yes. And AFK has been very like instrumental, a big exam for the licensing journey for like a dentist who's coming to Canada. So I think AFK is not going anywhere.
Yeah, because the NDEB is conducting it, it would be odd for them to switch. But I guess the universities, they're not conducting the AFK. They're just choosing which exam to take. So they're switching to. Yeah, interesting. Makes ADAT more valuable, makes it more of an option.
Yes.
And now you could also, like 3 things you could do with ADAT if you take it, right?
Yes, you can go for like a foreign trained dentist who comes to Canada. He can apply for the universities through ADAT. And if they are a specialist from back home, they can look into the options of applying to the specialty through that. You can go to University of Toronto's website and see what seats are available and which specialty. And from 2025, you can apply for that.
Yeah.
And then obviously you can apply for, you can look into the programs for US also, like the specialty residencies.
So people could,
you can look into that also.
It was made for, like,
it was initially made for that.
It was initially used for that, specialties in the US.
Yes.
And Canada now is using it for, the University of Canada is using it for specialty and general dentist for foreign trained dentists.
Yes.
For foreign trained dentists, yes. And is it only UFT so far? That's
I
doing
just read
this?
for University of Toronto.
Yeah,
probably we can do a bit more research on
probably
that.
more will follow suit, right? And start. Yeah, it's very interesting because you do ADAT now, And it's kind of like a passive, bonus that you get from doing the ADAT. Like you didn't need to do an additional work.
Another like a separate application.
Yeah, like how it was before.
Yes.
Because now you automatically get that. If you are a specialist, you automatically get that opportunity to apply to it.
Exactly.
Which part would you say is the unpredictable part? Was it the DSCKE exam itself, or the part after where you're getting a seat in the university, the DSATP? Like, if you know.
For me, it was more of the availability of seats. Like now, also every specialty would have one seat available, one seat per specialty, and some of the specialties do not have the seat. So the unpredictability of whether next year the seat would be there, would not be there, and which university. Everybody has their own way of getting people in.
Yeah.
So for me, that part was
the main part.
So I went with the general dentistry thing right now.
That way they would know. Yeah, they would know, like, once they're done ADAT, they could check if there's a seat or not and just make that application.
Exactly.
Very interesting. Yeah, ADAT getting more powerful.
More powerful and more important.
Taking over, beating AFK a little bit.
I really hope, like, with AFK, people start preparing for ADAT.
I do tell people, like, when they get in the consults, I tell them, look, you're studying so hard for AFK. Why not do that extra month of preparation, month and two, and go for ADAT? What?
Like for me, I did AFK plus ACJ.
Yeah.
Then I gave my exam.
Then your ADAT after the ACJ?
After my ADAT.
Yeah.
So, but because now we have the curriculum in. So we know that if you're preparing simultaneously for ADAT or doing like the extra 1.5 months for ADAT, it's good.
Yeah, like it will save you much more time if you do it right after AFK than finding out maybe months later that you're going to do it.
Exactly.
And then needing to kind of review all over again.
Yeah. Anyways, we are teaching them how to solve the clinical questions.
Exactly.
So
for me, I think it's a no-brainer just to kind of
you should
get it done.
Like if anybody is planning for like ADAT, a university pathway, should start preparing for the AFK.
Yeah. Some people, like I've had some consults where some dentists are just like, I know I don't want the university pathway. It's not an option. So I go like, okay, but I would still do it. You don't know what's going to happen in the future, but if you're very determined, okay.
I kept both the paths open.
So yeah, keep both pathways open.
Yeah, there's no harm.
Yeah, just do it.
You are studying it. You are just studying it a bit extra. Like you are going that extra mile to have one opportunity in your hand. It's not bad.
Did you feel it was easier to go through ADAT than after the ACJ versus after the AFK directly? Did the ACJ help a little bit with the ADAT? Because you scored high on ADAT, right?
Yes. I don't know. Now
you want to share that or not?
At my time, like when I gave it was like a pretty good score at that time. But for ACJ, it helped me answer the clinical questions. Now, when we made that program, so we made sure that when the students are taking that ADAT program, they will be able to answer those clinical based questions. So I got the help of ACJ in that section.
Yes.
But yes.
But since we created the program, then you don't need to wait for ACJ. Just do AFK course, try to get maybe a bridge or course of ADAT. Go for ADAT after would be ideal if you're doing both pathways. And that's if you're planning for university, and then opens up the specialty if you're a specialist.
Oh, that's I'm still getting the grip of that, but that's a wonderful thing what happened. ADAT and getting into the specialty, it's a good thing.
I wonder if one day it's just going to be all ADAT. We're going towards like a universal thing. Everything is becoming one. Like we're all using one exam. I don't know. Who knows? Maybe one day.
But like US is retaining both exams. US is keeping INDB like for the internationally trained dentists.
Yeah.
And ADAT is a plus exam. Okay. Some universities are saying, okay, if you have ADAT, we would consider it as a plus in your application.
Oh, really? Okay.
Some are not considering it. So for them, ADAT is like in US, it is that ways. But IMBD
is for foreign trained dentists in the US. ADAT is for
the specialty.
Usually if you want to get into a specialty, even for people graduating from the US, they do ADAT to get into a specialty.
They start preparing for it in their final year.
Yeah.
So if somebody is planning to apply for a specialty, like post their DDS, so they start preparing it in like final year. So.
And so if someone is doing the IMBDE, and they're a foreign trained dentist in the US and they're going for a university because that's the only pathway there, it would be a plus on if they're doing ADAT.
Some universities say it would be a plus. Some would say it would not matter. But
But who knows?
But like having a good ADAT score in your application,
it's gonna look good.
It's gonna look good.
Yeah, for sure.
So yes.
Yeah, that's interesting. Well, that's a good update. I think that, is very beneficial people to know.
Yes.
That the specialty pathway is being sort of resolved. There was a gap where no one knew what was happening. Is it gone forever? Is it going to come back? And now
there was not much information on that.
Yeah, it was just transferring it to this organization, NDSE, and then and now UFT took that initiative of like showing that, hey, look, there's potential for specialty pathway using ADAT.
Yes.
I think usually other universities are going to follow the same path. Usually,
Hope so.
Yeah.
Hope so. So one of the biggest questions which students have nowadays is they are good at communication, they speak well, but why are they failing SJ? Mm-hmm. So what do you think about that, Dr. Ahmed?
Yeah, that's what I was trying to articulate it, and then I think we came to the wording is like they're too scared of showing vulnerability in their communication.
We were discussing that.
Right? Yes. So it's like if there's something they want to come across that everything is perfect and they know everything confidently without any doubt. And I don't know if that's genuine in the way that you'd actually behave with patients. Like sometimes
basically genuinity.
Yeah, you don't, it doesn't come across that you're dealing with a live situation. Sometimes there's things you might not know. You might say, I need to consult someone about this. You might, defer something to be sure of another.
Yeah.
If you're not sure of the diagnosis, you might say, you know what, let me wait for a while until they're not seeing that you absolutely are 100% confirming something or a diagnosis. What if the diagnosis actually is the symptoms you have are confusing? Sometimes you have a patient where the symptoms are not textbook.
Yeah.
Do you have to give a textbook answer? Well, no, maybe I will do some sort of intermediate management and observe it, that's just the reality, right? So it's like being scared of saying that, I think.
Being scared of being wrong.
I guess so. Being scared of being showing that you might not know something and you need to wait to know.
Being scared of being vulnerable.
Yes. Being scared of being vulnerable not being able to say, maybe I gotta go do some more research on this.
Yeah, probably.
I had a patient where let's say I'm doing my first full mouth rehab, right? I learned some techniques and I told him this is my first time doing this.
Yeah.
So I told him
exactly. So I think the patient would have appreciated it.
And he was so happy with me. He liked my word. He was like, yeah, go ahead for this.
Exactly. So let me ask you a question, Dr. Ahmed. What do you think is the difference between a person who is pursuing dentistry from here or who is born and brought up here and a person who has come as an internationally trained dentist? What do you think is the difference between their communication styles? Mm-hmm. Do you think there is a difference or the people who are coming from different countries, what do they need to incorporate in their communication style? Mm-hmm. What is that one thing?
So
I won't say it is the proper English, but
I didn't work enough in Syria back home to know from experience, but I could kind of know from how I felt about it, right?
Yeah.
So and how I see people are doing. So I think coming from other countries or unaccredited countries, I find that the culture there is more like the dentist has to be the all-know-it kind of. There's this pressure where you have to be certain with all your patients almost.
Yeah.
And you can't say you don't know, or people might consider you a bad dentist or something.
Probably incompetent.
Yes. And whereas here it's very we're very open about a complication. Mm-hmm. We don't take a complication of a procedure. We don't put that on us as being incompetent. It's just a consequence of the procedure.
That's interesting.
Which the patient got themselves into because they didn't do the preventive work probably. So if the patient didn't do the preventive work and now they need treatment, okay, I could apply treatment, but the way your tooth is going to respond to the therapy and the possibility of me interacting with your tooth, there could be complications. That's not the dentist's fault. I think it's that guilt. There's a guilt feeling with foreign trained dentists, I think, that if they, let's say, break an instrument, it's their fault or something like that. Or if they cause a complication, it's their fault, right? And they feel guilty about it. Whereas here, there's no guilt associated with that. It's more like, this is a complication that could happen with this procedure. We're human. I'm here to apply the procedure. There's complications that could happen with it. It's not my fault. It's not that's just the where the tooth is right now. So it's kind of that.
Okay.
I don't know if I communicated that the way.
Yeah. No.
Did you come across right?
Yes,
like you got it. Yeah.
Yeah. So
I think it's there's a big difference in that. One student was like, "Oh, I did an implant. Back home, if I would do an implant to a patient, and I think he said like if something fails, I do the implant for free or something like that, or like if this tooth I do a root canal and it fails, I do the implant for free."
Yeah.
Because they have this guilt, like I'm doing the root canal, and I think maybe patients there want that, but here it's not professional to display that you're kind of taking fault if the root canal doesn't work. Like you're doing your best to do the root canal, doesn't work, it failed. That's it. You charge for the implant, and you charge for the extraction. But, it's not like that's.
But I think it starts from the base level here. You start with the proper informed consent. You explain to the patient. You take time. You take out time to explain to the patient, like, okay, I'm doing this procedure. See, this is the complication. This is like benefit of the treatment. If you don't go ahead, like, this would be the consequence. So talking to the patient, explaining beforehand, like taking out that good amount of time, probably that helps.
Maybe that's what it is. Like, is it? Because again, you practiced in India.
Yeah, for 10 years.
So like, was there the step of informed consent, like in India or like in Syria? I'll tell you, like most likely there wasn't.
There is. I won't say there is not, but what I feel is the way of presenting things here in Canada is different.
It's more official when you're stating.
One thing I would say, we have learned to be more empathetic. Like as a dentist, if I'm coming from like a different country and when I'm coming to Canada, being the part of this community as a whole, like a Canadian community, and seeing people around, interacting with people, it has like you have become more empathetic, and that vulnerability factor which we were talking, I think that comes into the communication. So I think that
even
one
communicating the informed consent, I feel like you could communicate it in a way where you already feel like it's a scary thing. Like you're already like that's even something you have to get. I feel like we have to get rid of. So it's like if you're talking to a patient, it's like, look, if we do this, this could happen. This could happen. I'm so sorry. Like it's not your. You don't have to be worried about. This could happen. Yes, but this is the best path. Like this is the best option for you now. But there's risks. That is what the reality is, right? And it's not. I shouldn't have to feel guilty or sad about it. It's just the reality, right? I feel like even explaining that to the patient, we're already putting ourselves in a way where like we're scared, like we're already like telling them like, oh, like sorry that this could happen, but no. First of all, one of the mentors I had would, I'm only responsible for one set of teeth. That's my teeth. You're responsible for your teeth. Okay. So if you got them to the point where they are, I'm here to help you fix them. But if you didn't do the preventive work, if you didn't come in for checks, if you didn't do all that, that's where they are now. But we could help fix them. But there's complications with that.
So the correct information in the correct way.
Yeah. Right. So it's that's a good point. So back to what you were saying about the communication.
Yeah.
Where we're at, like you were saying like delivering the correct information the correct way, pretty much is a good way of stating it, and being vulnerable, allowing to be vulnerable when you are vulnerable, showing that is okay.
I think that most of us have to learn. I learned it the hard way.
Yeah.
So, but I think we need to accept it that
you don't need to be overconfident, in the exam.
We need to accept it that we are humans, we can make mistakes. It's okay to be vulnerable. It's okay to be wrong. So these things, I think, people who come from like different countries and they come. So that is, I think, is a Canadian culture. If I would put it that way, that it's okay it's okay to be wrong. Accept it. It's okay to be vulnerable. It's okay to show, you're in a dilemma. It's not wrong.
Like an example, like I don't know this. Let me go do some research and get back to you. Can we book a follow-up, for that? This is a complicated tooth. I cannot do it.
Absolutely.
I would rather refer this to a surgeon. I'm limited in my skill for this.
Accepting it.
Whereas I think in our, like back home, it was more like, being good at everything makes you the better dentist.
You have got the degree, you need to know
everything.
Exactly.
Here, it's more like, no, knowing your limit is what's good.
That's the best point.
And I think that comes into ACJ practice a little bit.
Oh, yes.
Because you have to know when not to answer.
Exactly. Yes.
Yeah.
That's good.
Good point. Yeah. Thank you.